About that question, this is CiClesonide, and this here is a maintenance inhaler. And you asked me whether I could explain it from the start. You did watch that video and you didn't feel like I went over the beginning properly. So I'm happy and it's my pleasure to go over that again with you. When you get it out of the box, this, by the way, is a maintenance inhaler. I did a live today just to answer your question, so I went in depth about the surrounding conversation related to inhalers. I want you to know that you need to differentiate this inhaler from your rescue inhalers, such as these. And albuterol sulfate is very similar in shape to your maintenance inhaler. This is your rescue or quick relief, and this is your maintenance. They look very similar. Technique is the same. And I'm just going to go over how to use this device so that you do not mess it up. Look at the timer. It's going to give you, it's counting backwards. You're going to make sure you prime it very well, shake it up, and then you're going to open it up. And you're going to test your prime, and that means it's working. This one is out, so there's no medication that's going to come out of it, but you should still shake it, exhale everything out, and then that means you got the medication. You count to 10. I make sure that you understand that this could be dosed as 1 puff twice a day or 2 puffs twice a day. Please make sure you clarify with your provider what your dose is. And if it's that way, it will be every single day when I prescribe it. It's every single day you're taking it twice a day. So don't skip around and do it once a day because your effect is going to be totally different. Remember, there's dose. This one has, I believe, a 40 mcg and an 80 mcg. Oh, actually, no. I misspoke. It has an 80 mcg and a 160 mcg. It may have other doses. Just make sure that you know what your dose is, because if the 80 gives you a partial relief, maybe your doctor will want to do the 160. But before they do that, I usually recommend, if you're okay breathing wise, that they check and make sure that you're using your technique optimally, so that you get more of the breath with medication. If you do not, then you're not going to get a full breath of the medication, and it's going to give you a lower effect. I'm sorry about the noise in the background, but it's whenever I'm recording, that's when everybody is doing everything. So I just want to make sure you guys are clear as to the maintenance versus a rescue. This is a maintenance inhaler. It's going to be twice a day. This maintenance inhaler is twice a day, but there are maintenance inhalers that are once a day, but a lot of them are twice a day. This is a twice a day as well. And these are very similar to looking like these, but these are once a day. So you want to make sure you differentiate them. So your inhaler was this one. We went through this, but if your inhaler was something like this, be careful and check and make sure that you're not dealing with a one that looks like Alvesco but is a rescue. So differentiate it, make sure you look at the names and make sure that you have the right name. I am going to also advise that you rinse your mouth after, especially Alvesco. But if you don't know, rinse your mouth after all, because the residue can make you feel like you're hoarse or cause your tongue to have a whitish discharge on it, which is the thrush or hoarseness. I hope this helped, and I think you were referring to either looking at the counter, which should count backwards all the way to 0, like mine is at 0, so it's out. And when it gets to the red, it's when you want to make sure that you have already a prescription with your provider in the pharmacy. And the other thing would be just to make sure that you prime your device, and priming is jump starting your device. And if it's the first time, you've never used it before, you should prime it, which is shaking and then opening it up and pressing it. And then don't do that again. If you're going to be a consistent maintenance inhaler, this will be used in the evening, then you already did the priming for the first dose in the morning. So that's fine. Now in the evening, you don't need to primer again. It's going to be fine. It's when you're using the maintenance inhaler sporadically, which you shouldn't. I advise that you would shake it first and prime it, because it's been sitting for 2-3 days without use, and therefore it will guarantee your breath. And you want to make sure you guarantee the full breath with medication by sending it down, making sure that your tongue is out of the way. Don't block in. Keep your tongue down as you take in your breath. Down. So you're opening the airway to receive the medication, and make sure you take a deep breath and time it so that you're not mistiming it. Okay, don't do that, of course not. You want to suck that in, so you're going to time it as exhale everything out, and then inhale and press at the same time. Okay, so I hope that helped in clarifying your question, and thank you so much for your question, because I've used it to do a few things live here, live on TikTok, and I'm going to do a video for you and also post this teaching for you related to your question. I hope this helps, and see you next time. Take care. This is Dr. Mkono.